Sorry, my hands are cold. And so with this patient, she's not really going to have a subluxed shoulder. So what you're going to see is just a slight contraction, and that's all I care about. I see a little twitch. You can tell me you see a twitch. That's fine. This shoulder has, in real world, you'll see a lot of these strokes. After time, it becomes flaccid, so that muscle will weaken and stretch, and that shoulder will sublux, and it'll come down here, and it causes a lot of pain. So as you're trying to strengthen that muscle, they may not be able to move it good. You can do this, and this should pull that head of that humerus back up into that fossa, okay? And that's what we're trying to do. That's all this is going to do. It's going to be a slight contraction up, all right? Now I want supraspinatus fossa. So right there, right? I'm going to put it right there. I'm going to let my lead hang down. Now the posterior deltoid, where does it go to?
Kind of right back behind the shoulder area. Like, yeah, right in there.
Where's it insert at? What's that called? Remember?
Oh, the deltoids were the easiest. What were those?
Deltoid tuberosity.
Wow, that was easy.
And it's going to be right in here. So I would just I wouldn't have to go right over that. And I will show you what they call points that are trigger points that really you can supposedly put this over the best spot. But usually we just put it over the muscle belly close to insertion. So I'm going to put it right in there, okay? Here we go again.
You don't want this one?
No, I got,
Oh.
it's the next one.
Oh, okay.
So that old one is the same one we use, right?
Yes, it says right on your scenarios.
Oh, yeah.
The next one is the new one.
Question.
Yes.
So it's kind of a stupid question, but are these the exact scenarios?
That's
like
them.
it will say everything this says?
No, you'll have to memorize these.
The right side of
But
it?
it will say,
It'll just say like this.
yes.
Okay.
You gotta know that.
Okay.
Yep. That is the scenarios. You'll have to memorize the settings.
That is a lot to memorize. All right, good.
Okay. Now, where did the black and the black go?
The black goes on the supraspinatus, maybe? No, posterior delt.
So the black goes down here, and the red goes up here. And I would tell my patient, you're going to feel a little bit. We're just, again, explain to her why you're doing this. Again, remember we talked about those two things I want to hear. So one is that it's coming down, it's causing you a lot of pain, and that's because you've had this stroke. On this side, everything's become weak, and now that muscle's getting real flaccid and atrophy, and it's coming down and it's causing you pain. This should help pull that up and hopefully relieve some of that pain in your neck. That's what we're doing. Okay? And now you're going to feel, and being a stroke, you may feel something, you may not feel hardly anything. But if you do feel something, it's going to be like a tingling and kind of a buzzing. That's okay. Don't worry about it. It's not going to hurt you. If it gets too intense, let me know and we'll turn it down. That's what I would tell her.
Is there a setting on there that you have to say that it's a single channel?
Well, yeah, I think it tells you on here. Yeah, let's go through these. So I got custom ready. I turned it on. Go to setup. Now I'm in NMES. So I go to next. And Mark really shows it really good on that when we took it in there. Now I'm on custom. It's PPR and custom. Same thing I did earlier. I go to custom. Okay, on time. What's my on time?
24 seconds.
24 seconds on time. So I'm going to change this. And that's why it was changed earlier. There's my 24 seconds on time. I go to the next.
2.
2 seconds on off time. Okay, it's on 30, so I'll go down to 2. So this thing's going to be what? On how much?
24 seconds.
Yeah, it's going to be on, and only going to be off too. So it's going to be on constantly almost. Where the other one had a pretty good time it was off. Okay, now I'm going to go next. Rate. What's my rate?
25 to 35.
Okay, again, and I'm at 30. I think that's about the same. I go to the next, and it's got waveforms, synchronous and asymmetrical. Or symmetrical and asymmetrical.
Symmetrical.
Asymmetrical?
Oh, sorry, I'm on this third one.
Okay, asymmetrical, right?
Yes.
Okay. Arrow over, alternate or synchronous? Synchronous. Ramp time?
2 seconds.
2. It's on 2. Go to the next. Pulse width?
2.
200 to 400.
2 to 4, I'm on 300, so I'm gonna leave it. Timer 20, we'll leave it 20. Just keep going across, lock, exactly, I want no. Now here we are, okay? Now remember again, I'm just gonna start airing the intensity up, right here. That's gonna go up. And that's my fault, I don't think I explained that well, it's the way you asked that. Here's the intensity, channel 1, channel 2. All I gotta do is start arrowing. Once I get it set, that's my fault.
So you
Once
don't
I
have
get
to-
it set, I just go with the intensity and start arrowing. That increases my voltage. That's all I'm doing is increasing the voltage.
So channel 2 is technically set up, but you just don't put the intensity up.
Yeah,
Okay.
we're not gonna use it,
Okay.
okay? And that's where you could use like the the alternate. So it would go one, go to the other one, go to one, but we don't use it in here, all right? So now I just start turning again. I watch this, and when that light is on, she's got voltage. But it doesn't really know. If I stop and talk too much, I think that's when it'll automatically slip and go back into its mode and it'll start cycling. That's why you gotta be careful. So if you do wanna move the pads, make sure you turn the intensity all the way down, okay? If you take the pad off while that thing's got even a decent voltage, say she feels needs a little more but it doesn't bad, and I pop that baby off, it will light her up. I've seen it happen. I've seen Jeffrey Buchanan was laying down there. He come clear off the table one day, and his partner didn't think, she just pulled, I'm gonna move it. Ah, he screamed. You know, physically hurt him? No, it doesn't. There's not enough there. But it lights you up. You'll think it did. Okay, so just be careful with that. So I'm gonna start arrowing up. You tell me when you feel tingling, when you first start to feel something. See the lights on? It says 1, 1.5. It goes by half volt on this one. Okay, just relax. All I'm looking for is a contraction right in here a little bit.
What's kind of a normal intensity?
Like on the other one over there, 20 to 30s. On this one's not that much. Her being a good tone, you may not hardly see anything.
I feel like it's shaking.
Yeah, you can, okay. That, I saw a little jump right there, see it? There, see that fire right there?
Yeah.
That's all I'm looking for, that's all.
Ooh, I don't like the look of it.
Okay, I want you to relax because it's gonna pull that head up and it will make them feel better. That slack, loose muscle is gonna be pulled up where it's not stretched and painful. And it'll only shut off, it's gonna be on almost all the time. It shuts off for 2 seconds just to give that small muscle a little bit of relaxation, okay? I would arrow it down. Do not just shut it off. I would try not to pause it if you have to. I would go ahead and slowly arrow it down. I think book-wise, that's what you're supposed to do. In the real world, I just shut her down, okay? When that treatment's done, and they would wear this for a long time probably in rehab. You would see this in rehab.
So her muscle moved, but her shoulder didn't really move. Is
Exactly.
that okay?
And yes, that's all you're getting on this one. I mean, you're just want that contraction. If she had a really flaccid shoulder, subluxed, you could probably see it come up a little bit and move. You know, because we're not talking that heavy. The humerus is only probably down 1/4 of an inch or something when it's subluxed, but it's causing a lot of pain up in your rotator cuff muscles. They're stretching because all this flaccid arm is pulling everything down, and you're just trying to give her some relief.
Okay.
Okay? Good?